I'm Frank, I'm 79 years old, and I'm a cancer survivor. I was bleeding for a long time, so I had a colonoscopy and I was diagnosed with stage 3 colon cancer.
Good to see you. Hi, Dee.
Good to see you.
By and large, most of his treatment was actually surgery. So when Frank came to me, he had already had surgery and removal of the entire tumor.
I had a very good surgeon. His name was Dr. Victor Gall. Excellent surgeon.
And now you're on the other side of treatment, right? And you're back to
What makes Frank's case a little bit more complicated than the average case is that his cancer actually had started to grow into the lymph nodes, which means that it had started to spread, and that's what made it a stage 3. But it was relatively high risk for coming back, which is why we had to offer him chemotherapy to reduce that risk.
So Dr. Gall.
Dr. Taft said if I was her father, she would recommend it, so I took it. 6 months of chemotherapy.
He was scared like most patients, right? Nobody wants to get chemotherapy. Nobody wants to go through a cancer diagnosis or treatment. But once Frank understood that this is what he had to do to decrease his risk, to make sure that cancer was part of his story but not his whole story, he jumped on board and he said, let's do this.
So lean forward a little bit for me. Big deep breath.
Dr. Taft and Dr. Gall are exceptional doctors. I was lucky to have them. We spent a lot of time talking about other things. I had an organic garden. Dee and I were farming 1,000 square feet of garden. Dee is a girl I've been with for 11 years, my significant other.
For Frank to continue to be able to do his gardening during this process, I think was such a great comfort to him. He would come in and say to me, Dr. Taft, I woke up at 5 a.m. and I worked in the garden for an hour or two. He showed me pictures of fruit that took up like 2 or 3 double beds because it was so productive on a weekly basis and he would just give it away. And I think he missed it, but at least he got to do a little bit of it. That patient-doctor trust is everything. And that doctor-patient communication is really 100% of the relationship.
I told her once that your office is getting busy because you're a good doctor. She told me she'd rather she wasn't busy because there'd be less people sick. That's a good concern, doctor.
Frank is doing amazing today. He completed his chemo. I think Frank has a very bright future ahead of himself and many, many, hopefully cancer-free years ahead.
I'd like to thank Dr. Taft. Couldn't ask for a better doctor.